At the start of the school year, students are getting back into the classroom, and for athletes, they're getting back onto the field and court. Preparation means conditioning or getting physicals, but injury prevention may not be top of mind. That's why Bridget is standing by now to ask a doctor.
Ask a Doctor is sponsored by Red Mountain Weight Loss.
So football, of course, is one of the most popular fall sports headed into high school, and a hard hit or around the head can be dangerous. But it's not just football. There are so many other athletes at risk, including our student athletes. That includes cheerleading, soccer, and more. Joining us this morning, Dr. George Eldayrie, an Orlando Health Sports Medicine physician. Thanks for stopping in.
Thanks for having me.
I know it's getting ready to get busy for you.
It is, yeah. This is the season, absolutely, as we ramp up with the school starting back and sports starting up again.
And you know, we talk about student athletes, and there are so many things to take into consideration when we're putting our students into sports. What do you recommend for parents when it comes to, getting them prepared, trying to select the sport that best fits them, and weighing out the risks?
Yeah, I think sports in general is great for all kids to get involved. I think there's a lot of health benefits in general. So getting prepared for sports really just has to do with getting in early, trying to stay in shape as best you can, but some kids, it's their introduction to exercise, so we want to encourage that as well. But checking in, getting your physical, make sure everything's ready to go, and then choosing the sport that's probably right for you based on your underlying medical issues or a history of playing sports.
And what are some of those underlying medical issues? Because we're looking at the heart, we're looking at head injuries. What are some of the things that really need special attention?
Right. When it comes to head injuries, for sure, a history of concussions is something that you want to take really seriously. And typically after a concussion, you're at much more likelihood to have further concussions, and each one can become more severe afterwards. So you want to take that into consideration when it comes to collision sports. But other conditions too, typically there are modifications that can be made, and people with certain conditions can still participate in certain types of sports. So it's good to consult with a sports doctor to figure that out.
Now, which sports have the highest amount of concussion rates?
Yeah, typically it's the collision sports. So in men's sports, it's going to be football primarily, hockey, soccer. In women's sports, it's soccer primarily, basketball. We see a lot in cheerleading.
Mm-hmm. And when it comes to those signs and symptoms, whether it's practice or a game, how can we keep an eye out for whether or not they might need further treatment? And how long does that monitoring last?
Yeah, I think everybody should be aware of the signs and symptoms of concussions, from parents to coaches. Certainly schools that have athletic trainers should be in tune with what those look like. Typically, any type of injury to the head where the athlete looks like their mental status has changed a little bit, where they don't seem quite off, should key you in that something may have happened. Common symptoms are headaches, dizziness, looking like they're uncoordinated, maybe not remembering things or not seeming like themselves. They're all signs that something should be looked into further.
So what's actually happening? How does it affect the brain?
When a concussion occurs, it's a mild traumatic brain injury. So there's a degree of damage that happens to the brain cells, the neurons. And when that happens, some chemical changes happen with electrolytes, and it causes a vulnerable period for the cells. So typically within 7 to 10 days, the cells can start to heal themselves. But if you have recurrent injuries, the damage can be further progressed, and makes it much harder to recover. So the symptoms of concussion can last longer. The long-term effects of recurrent head injury can last longer.
Mm-hmm. And what about treatment options? Because what would constitute stay home and rest, or you need to stay in the hospital?
Certainly. So immediately after a concussion, rest is the first line. So we typically have the athlete find a nice dark place where bright lights can't bother them, loud noises can't bother them, someplace where things are calm and their brain isn't overstimulated. Anything that causes a symptom for their concussion really should be avoided, whether that's reading, looking at your phone, watching TV, anything like that. Those who need hospital care really are the ones who are showing a serious decline in their neurologic status. So that's usually evaluated immediately. And if they're showing any sort of progression, like they are getting worse, the headache is getting worse, they're vomiting multiple times, it seems like they're getting agitated or their personality is changing significantly, those are signs that they need to go into the emergency room.
And of course, we have just a little bit more time, but this is so important because we're making those links to degenerative conditions later in life because of these types of injuries.
It is, and there's still a lot that hasn't been defined yet. It's a field of study that we're still learning more and more. Certainly the hot topic is what we know about CTE, but we don't know a whole lot yet, so we're still learning. So we're trying to avoid as much bad head trauma as possible.
Right, so making sure you're safe out there, padded up, and
That's right.
getting into the doctor if you need to. All
right.
right, thanks, Dr. Eldayrie. I'll send it back over to you, Jules.
All right, Bridget, thank you.